Hi, my name's Hannah. I'm 30 years old and I have ulcerative colitis. I'm a school teacher for secondary age children with special needs, and I also own my own dance school. In the initial stages of being diagnosed with ulcerative colitis, my disease was quite aggressive. I hadn't been diagnosed until 12 months after my symptoms started due to investigations, and I was using the toilet up to 30 times a day, losing lots of blood, lots of mucus. I was malnourished, I was vitamin deficient, I was severely anemic, which resulted in me being, in bed or on the sofa for about 3 months. And that was when I was at, my most sick. I had no quality of life. And it was really, really debilitating. It impacted my personal life and my relationships. It impacted my work. It was at one of my consultant's appointments in his clinic. Professor Limdy, who I owe my life to, has just been amazing. I've been so well cared for and so well looked after, and to be blessed with someone in the field who's so knowledgeable and passionate about what he does and achieving the best results for his patients, I couldn't have wished for anything better. And I trusted him when he suggested entering a clinical trial for etrolizumab, which is an injection that I take once monthly, and it helps the balance in the gut and stops a protein that is sent from the brain that causes inflammation. And I knew that going forward, to get my disease under control and achieve that true clinical remission, that this is the step that I needed to take. So this is the research ward that I regularly attend at Fairfield General Hospital. The team here are so welcoming and friendly and make you feel really at ease. When you're a patient on a research medication, your first kind of thought is the adverse effects and the side effects that you might experience. But they take all that anxiety away because you're so closely monitored. Every aspect of my health is so cared for at such a high standard. So that kind of eases that anxiety that you would usually have when taking part in a research trial. Since taking part in the study, my symptoms have completely gone. I've achieved clinical remission, and I've got my full quality of life back. So I owe everything to this ward and the research team here at Fairfield. Whilst in clinic recently, I met another patient who was in a similar position I was a few years back. She was really poorly, really suffering with ulcerative colitis, and she didn't have much of a quality of life. I had a chat with her and she was really tearful, and it was really sad to see. And she explained that it had been offered to her for her to enter upon research and try a new medication that was out to be tested for ulcerative colitis. She explained her anxieties to me and was just really apprehensive, and I was able to have a chat with her. We exchanged numbers. I told her all about my experience, and she could see for her own eyes how positive it was. And she changed her mind. She went with the trial. I see her on the ward and she's doing much better, and it's just so rewarding that through my own experience I've been able to help someone else, and I will go on to help as many people as I could, because it really does change lives. I just believe that without people going on the trials and being able to collect data on these medications, then they're never going to be licensed and we're never going to move forward with healthcare. When you embark upon those trials, you're at the forefront of medicine, and you're not only changing and improving your own life, you can change and improve the lives of many, many other people.